Hello guys, I hope you are doing well. Welcome back to the Talk to Your Midwife session. Now, today I want to explain the reason as to why it is very important for a pregnant mother to do a urine test every time she goes for the ANC visits. Now, there are three things that are very dangerous in case they are found in your urine. Number one, we always look for an infection, mostly the UTI or urinary tract infection. So when your urine has some pus cells or has some white blood cells, then it means it is dirty, in quotes. It is dirty and you have an infection. And according to how much it is, there are those ranges that the lab people will give, then maybe the number of white blood cells or pus cells that are seen there. Now, in case you have an infection, it is good that you get treated, because whenever you have a severe UTI, it can lead to you having some abnormal labor or preterm labor, and some can at early stages can even lead cause, when it is so much severe, it can even cause a miscarriage. So it is so much important to treat your UTI. In case you have you get affected of, you treat it so that it doesn't go into the severe stages. Number two that we always look for in your urine is glucose. Normally, a healthy mother, a healthy person should never have glucose in your urine. And in case you have glucose, then it means you have a lot of glucose in your blood system. So you might be having high glucose level, or high sugars, or what we call diabetes. And in case you have never gotten diabetes in your whole entire life, and you get diabetes during pregnancy, it is called gestational diabetes. So gestational diabetes should be treated, because it will definitely affect your pregnancy. It might even make you lose your baby, or get have abnormal labor, preterm labor. So it is good to check your glucose in urine, sorry. And in case we get glucose in urine, we don't conclude that you have diabetes. What we do a blood test for you to check whether you have glucose in blood. Sometimes it might have leaked in the urine and it is just okay. But in case we go to an extent of finding glucose in your blood system, then it definitely means that you need to go for further checkup of the blood glucose, and before we conclude that you have diabetes. And in case we conclude that it is diabetes in pregnancy or gestational diabetes, we have to start you on treatment immediately, and advise you on the dietary regulations on what you need to eat and drink, what you need to do to avoid you having more and more glucose or high sugars. Even in the diabetes also, you can get ketones. There are things that we call ketones. When your body, maybe you have not been feeding frequently, and your body is starving, what your body does, you can't die immediately, but what your body does, it takes some fats, stored fats in your body, and starts to break the fats down so that it can get glucose from those fats. Now, when fats are broken down, you get glucose, and you get things that are called ketones. Those ketones will be found in urine when something of the sort has happened, or when you have undergone some starving of food, and when you have not taken water for so long, maybe you have dehydration. So when you have ketones in urine, it can also be a sign that you have dehydration, and what you need to do is take a lot of fluids, a lot of water. It will go and clear the ketones. Now, the last thing, which is also very dangerous in case we find it in your urine, is proteins in urine. A normal mother should not have proteins in the urine. In case we get proteins in your urine, we need to keenly check your blood pressure. And this you can relate in case you have ever had maybe pregnancy and you had a checkup of your blood pressure, and the blood pressure was very high, maybe your BP was very high. A nurse or a midwife or a doctor will immediately refer to you to the lab to go and check your kidney functions and your liver functions, and do a urinalysis, that is a urine test, to check whether you have proteins in urine. This condition in pregnancy, there is a condition in pregnancy that is called PET, or pre-eclampsia. This is a complicated case of hypertension in pregnancy, and mostly when you have PET, you will have a high BP and your urine will have proteins. So in case you have proteins in urine, we will recheck your blood pressure, and recheck and recheck again. And in case it is very high, we conclude that you have a condition called PET, pre-eclampsia, and this needs immediate management before it complicates further to a condition called eclampsia. So it is important, in case you get proteins in your urine, inform your your doctor, your midwife, or whoever is taking care of you during your ANC clinics. Inform them so that they can do further checkups and maybe check whether you have any other conditions. So this is why most of hospitals nowadays will insist on you doing a urine test every time you go for checkup, and this is normally after every 1 month. So this month you go, you check your blood pressure, you check your vital signs, you will check your blood pressure, you will check your temperature, you will check the weight, because we expect you to be adding weight because the baby is still growing, and the baby, when the baby is growing, it means the baby is adding weight even on you. So that's why we will check your weight every time you visit. We check your weight, we check your blood pressure and other vital signs, then we check on the urine. So now at least we can understand why we have to check urine every time you go for a ANC check. Anytime you get some abnormal readings from the lab from that urine, kindly just let the doctors start you on medication. Do not wait, especially in pregnancy. Mothers, please, kindly, do not wait. Do not question your doctors. Do not refuse to do what they are telling you, because remember, we are not only focusing on you alone, we are focusing on you and the baby. We are after saving both lives, the mother and the baby. And remember, mothers, anytime you have something, like you have a disease, you have an infection, you have an abnormal condition in pregnancy, a big percentage, like 99% of all these things, will end up affecting the baby, will end up affecting that pregnancy. So you might find yourself not reaching term, not reaching where you're supposed to, like 40 weeks, 38 weeks. You might find yourself having some preterm labor, some complications, maybe your baby even going to an extent of having abnormalities. So it is good to always be keen, always do these tests, especially the urine test and BP checkup frequently, and just allow the doctors to guide you through treatment and through management of anything, any abnormality or any condition or disease that they will find you having. So thank you, and always learn to cooperate.